So hydrating the graft is something that you do so that it's easier to deliver the graft to the site. Once the graft is in the site, it's going to absorb some blood as well, which is what we want to have happen. But the question is, what do you do to get it over to the site? So our options are using sterile saline. When you do that, you don't want to flood it in a bunch of saline, because then it's harder to get the particles together. You can use anesthetic, but if you do that, use one without epinephrine. There's an option of using some antibiotics to put into the solution. Some people that I have over the years used metronidazole. I've used some tetracycline, but honestly, I haven't really found that it makes a big difference on healing. The other option is to use, a lot of people have heard of sticky bone. That's when you're drawing blood, you're doing PRF, and then using the solution to mix it with your graft material. It makes the graft material clump into a sticky kind of ball, and makes that easier to deliver to the site as well. You want to be sure that the graft is being hydrated for at least 5 minutes, so somewhere between 5 and 30 minutes. So dispense your material. Again, the surgical aesthetic material comes in its own dapping dish, so you just have to add some saline to it, or the appropriate liquid. Let that soak, and then once it's being hydrated, then you're going to deliver it to the socket. So we're going to talk about and do a little video on showing you the instruments that we use to deliver it to the socket. So here we go. We're going to just show some just general principles on hydrating your graft material. So again, graft material is a nice little dapping dish, and we can use a monojet syringe, or if you're using anesthetic, you use syringe boat. So we're gonna place the sterile saline in, and then generally I'll use a molt to mix it up. And then you go do your procedure, and then this will set for soak it all up for minimum 5 minutes. And usually it'll end up that there's a little bit too much water when you're trying to kind of scoop it up. So a good thing to do is to take a sterile saline gauze, and you can place your gauze like right on the edge here. And then if you take your surgical suction, and you take your suction and place it right on the other side of the gauze, it'll soak up all the excess liquid, so that you just have your hydrated material and it's easier to manipulate. So then I'll generally use your molt to take an amount of material like that to the mouth. And then once you take it to the mouth, you can place it where you want it to go, and then have either yourself or your assistant then place it with a bone condenser. And again, you want to use one that has a thin edge like this, so that if it's a skinny root, you'll be able to place it in the root. The other option, not using the molt, is to use the bone delivering instrument. The critical thing about this is don't pack it from this side, because it can get clogged inside. So you pack it like you did, for those of you that used to use amalgam, you pack it like an amalgam, and then you go to the mouth, and then you deliver the product. So on an upper molar, this is often a nice way to do it. Again, don't forget that once you've placed your material and you've packed into the roots, a lot of times the material won't go down to the tip of the root. So you want to be sure that you're taking your metal perioprobe and stirring that material, going right to the tip of the apex, stirring it, and then recondensing it and giving it a stir again. You want the material to be loosely placed and absorbing blood. You don't want it to be overpacked where you've squeezed the blood out of the material.